So I've arrived at the scene. I've checked for prophylactic scene safety. I've checked to make sure that we, my partners and I aren't going to get hurt and we're going to be safe. We find one patient laying approximately 60 feet from a car. He looks like he's between 30 and 40 years of age. There are bystanders, but no one knows what happened, so they can't give me any kind of history or events of what preceded this. I have donned my PPE and I'm wearing my gloves, and I'm coming to the patient. I'm going to have one of my partners hold cervical spine immobilization at this point because the mechanism of action really looks like he might have had a traumatic event. I'm going to once we have the C-spine held, I'm going to check to see if he's alert. Hello? Hi there? Can you hear me? Can you hear me? And if you can't hear me, I'm going to go on to painful stimuli, which matter of pushing in on his earlobes or also pushing in on next to his clavicles to get a response. With that and not having any response, I'm going to go on to airway. I'm going to check the airway at this point with a jaw thrust. I'm going to look inside. I'm going to see if there's a tongue obstruction or teeth or secretions that might need to be suctioned. I noticed that by moving the jaw thrust that his mouth opened, that his airway is now patent, so I know that I need to put an OPA to hold the tongue out of the way. So with the OPA in place, I'm going to check his breathing. I'm checking his rate. I'm going to check symmetry. Is the lungs coming up and down the way it should? Is the rate appropriate? And if not, if everything is okay, I'm going to put a 100% non-rebreather at 15 liters on him. If not, I will prepare to make sure that we have an ambu bag present at 15 liters also. I'm going to proceed on and check his respiratory drive again once we've supplied oxygen. If everything is still symmetrical and his rate is normal, I'm going to circulation. I'm going to check his radial pulse, but I'm also going to check a carotid pulse, so I'm going to check a central pulse in the carotid and a radial pulse is my peripheral. I'm also going to look for his skin color. Is he ashen? Is he pale? I'm also looking to see if he's warm and dry or is he cool and moist. I'm also going to do a quick sweep to see if there's any blood pooling anywhere behind the patient before we have moved him. And I'm going to check the extremities on both sides. After that, I'm going to have the other person who's not holding cervical spine to go and get the backboard and the cervical collar so we can apply the cervical collar and place them on the backboard so we can do the transportation to the trauma center. I'm going to quickly do a head to toe on him. So I'm going to check the head. I'm looking for deformities. I'm looking for contusions, abrasions, lacerations. I'm going to check the back of the spine. Are there any step-offs that I need to worry about? I'm going to check the front of the neck for tracheal deviation and JVD. I'm going to come down and I'm going to check the shoulders. Are there any crepitus? Is there any tenderness, any lacerations? I'm going to come to the chest, check to see if I can feel any crepitus, any deformity of the chest cavity. I'm going to check the sternum for stability. I'm going to come down and do the flank area, see if there's any tenderness. I'm going to do my abdomen area, all four quadrants, to see if they have any tenderness. I'm going to push in on the pelvis to see if it feels stable. I'm going to come down both legs, checking for deformities. I'm going to check pedal pulses bilaterally. Make sure we have good pulses to both extremities. I'll come up and do both arms. Same thing, checking to make sure that there's no deformities. I'm going to check a radial pulse. I'm also going to check cap refill on both sides. By this time, I'm going to see if anyone else, a bystander, has showed up that knows the patient, see if I can get any past medical history, any medications, any allergies, or anything like that. When they come, I'm going to get I'm going to have them come and put them on the backboard. So we're going to cervically hold him. We will put the cervical collar on, but someone is going to manage the neck as we turn. And at that point, I'm going to check the back for any deformities, any bruising, anything like that. We'll put him on the backboard and we'll load him into the ambulance. At this point, I'm going to do my secondary assessment. So I'm coming through and I'm checking now, really checking over the eyes, checking the cheekbones to see if there's any fractures, across the bridge of the nose, along the jaw. I'm checking to make sure my OPA is still patent. I check in pupils to see if we have had any changes since the last time. Checking for JVD and tracheal deviation. Coming through and I'm checking the chest again. Checking to see if there's any changes in crepitus. Checking across the sternum again. I'm going to listen to breath sounds in all 4 quadrants. Make sure they're all clear and symmetrical. I'm going to move down to my flank area. Again, checking to see if there's any bruising, any crepitus, anything like that. Checking my 4 quadrants of my abdomen. Pushing in on my pelvis to make sure that it's still stable. I'm going to come down my legs, doing each leg one at a time. I'm checking pulses. Bilaterally, I'm going to ask them to push down. Can you push up? If not, I'm going to check Babinski signs on both feet. Come through and I'm going to check the arms. And I'm going to go across the arms, checking my radial pulse to make sure it's still there. Checking my cap refill. Coming to the other arm, doing the same thing. Taking a pulse. Checking the cap refill. At this time, I'm going to do a set of vitals on the patient. So I didn't find any injuries to this upper arm, so I would do my blood pressure here. I would note my blood pressure and my pulse rate. At this point, I would have a paramedic meet me in transit, just in case the OPA were to fail. I would be doing vital signs every 5 minutes to make sure he remains stable. I would check a glucose. I would do an EKG. So that way when the paramedic does join us, we would be all set. And then I would activate the trauma team, or I would call the hospital to let them know that I'm inbound with a trauma patient.